Hello, and welcome to this introductory presentation about MO1013 Musculoskeletal and Orthopaedic Subacute conditions. This module will build your rural generalist knowledge and skills in service provision for clients experiencing complex musculoskeletal conditions. This will be examined through the lens of osteoarthritis due to its prevalence in the rural and/or remote context. You will enhance your knowledge and skills in assessment, clinical reasoning, client management, and self-management skills. The intended learning outcome for this module is that you'll be able to combine advanced knowledge of the etiology, pathoanatomy, predisposing factors, clinical presentation, and natural progression of musculoskeletal conditions, and assessment and clinical reasoning skills to formulate and communicate care plans designed to optimise care in the rural and/or remote setting in accordance with best practice guidelines and local service strategic intent. The module goes for 6 weeks with 22 hours expected workload. You can see the weekly topics here. In week 1, learn about your client's condition. You'll identify a client for assessment item 1 and gain their consent to partake in the activity. You'll access and familiarise yourself with your client's relevant clinical information and gain an understanding of the module's submission method and make a start on populating the formative assessment template. You'll test your osteoarthritis knowledge before learning more about the condition. Lastly, you'll identify and make contact with at least one health professional different to your own who works with clients experiencing osteoarthritis in your local area and ask if they would be willing to discuss screening, assessment and intervention in the coming weeks. Assessment. This week you'll locate assessment and intervention evidence for osteoarthritis and specifically your client's affected joints from the perspective of multiple professions. You'll closely review screening and assessment options and make contact with the health professional identified in week 1 to discuss screening and assessments from their professional perspective before preparing for the upcoming assessment with your client. In week 3, assessment continued. This week you'll undertake an assessment with your client before touching base with your module coordinator. You'll then complete and submit your assessment report and summary of reasoning for formative feedback. In week 4, intervention. This week you'll review the interventions relevant to your client using the evidence sourced earlier before making contact with the health professional identified in week 1 to discuss interventions from their professional perspective. You'll discuss potential interventions with your supervisor and make a start on your care plan and summary of reasoning template for assessment item 1. In week 5, intervention continued. This week you'll complete a care plan for your client before comparing it with evidence-based guidelines. In week 6, services and service delivery. This week you'll identify services relevant to your context and consumer before troubleshooting the complexities of delivering evidence-based healthcare. You'll discuss your care plan with your supervisor for the final time before submitting assessment item 1. Each week you will have several learning activities that will take up to 4 hours a week to complete and includes the time you spend on your assessment. A single assessment task is due at the end of the module in week 6. The task is a written care plan for your client. The plan will include an evidence-based rationale for intervention choices and strategies used to enhance a collaborative, multi- or interprofessional approach to intervention. You will also have the opportunity to submit a formative piece of work at the end of week 3. This is an assessment report based on the assessment undertaken with your client. It is not marked, but will give you some feedback on how you are going. We've built in some opportunities for you to interact with the content, the module coordinator, and other participants who are taking the module at the same time. There are learning activities which include contributing to online discussions. This provides a chance and an expectation for you to swap professional insights with others who may be from the same or other health professions. This mutual exchange of knowledge is the basis of successful collaborative team practice, so we hope you'll join in. You'll find the module outline in the Start Here folder. It contains your module coordinator's contact information, all the details of the assessment tasks and marking criteria, information about applying for extensions, any module prerequisites, and the module calendar. Please don't hesitate to get in touch for any questions or concerns, and enjoy the module.